Hi, my name is Ashley Adkins. I am a charge nurse on an inpatient rehabilitation unit, and today I would like to discuss the issue of sustainable change. What is sustainable change, you may ask? Well, simply put, sustainable change is one that lasts. That's very, very important in healthcare because we spend a tremendous amount of resources, both time and money and effort, on implementing change. And if it's not going to be a lasting change, well, then that is all wasted. So it is our job as nurse leaders and managers to ensure that the changes that we are implementing are going to be sustainable or that they will actually last. This can be very difficult because it's human nature to resist change, and nurses are no different. Unfortunately, we are subjected to change a lot in the healthcare system due to the fact that healthcare is rapidly evolving due to changes in technology and research. It's something that nurses deal with a lot in their careers is change. So as nurses and leaders and managers, how do we assist the change process, as you would say? First of all, we must involve our team in the planning process when we are looking to make a change. We must take that extra time to discuss the proposed change with our staff to ensure that their needs will be met. We must identify any barriers to change. During this planning process, we'll be able to assess the situation to determine or identify any issues that will likely cause resistance to change. That's very important. Change a lot of times isn't usually met with open arms by a lot of people. So we need to make sure that we are identifying early on what may be the barriers to change. Secondly, we need to ensure that our staff buys into the change. And what does that mean? Well, that means that they understand what the reasons behind the change, I guess you would say. They understand and they get it. They understand why we are implementing the change, whether it's a change that's going to improve patient safety or employee safety, or if it's a change that's going to just save money. We need to ensure that our staff and our team understands why the change is being made and that they buy in psychologically, essentially. This is very important if the change is going to lead to an increased workload. That can cause great resistance. And if the staff doesn't buy in, then that can lead to many, many problems, especially if it's increasing an already heavy workload of a nurse. Finally, we must welcome any feedback once the change is implemented. We must welcome that constructive criticism. We must have that open door that we all say that we do when implementing a change. If there's one point that I want you to take away from this discussion, it is that change can be sustainable if we effectively communicate with our team. Effective communication is the key to a sustainable change. We must listen to our team and, like I said, have that open door that we all say that we do to ensure that our team feels empowered. That is the key. Thank you. Have a good day.